All right, today we're going to jump into a really simple idea that's totally changing healthcare. It's called person-centered care. We're going to break down the ethical and legal stuff that makes sure you are at the very heart of every single medical decision.
So let's just start with this question. For a long time, the whole model was basically the doctor knows best, right? But what if your healthcare wasn't just about treating a sickness? What if it was designed around your values, your choices, and your life? That simple change in thinking is exactly what we're digging into.
So what even is person-centered care? Well, at its core, it's a massive shift in perspective. It's all about focusing on things like respect, dignity, and choice. It's about making you, the patient, an active partner in your own health journey, not just someone who sits back and gets treated.
Okay, so why is this such a big deal? Let's take a look at why this whole approach is becoming the new gold standard for what good healthcare should look like.
The benefits here are pretty undeniable. And you know what? They all grow from a foundation of trust. When you feel heard, you're obviously going to be more satisfied. And the fascinating part is, this isn't just about feeling good, it actually leads to measurably better health outcomes. It's a system that's designed to make you healthier while protecting your rights.
Now, to really get how this works, we need to look at the ethical principles. Think of these as the moral compass that guides every single healthcare professional. This is all about what they should do.
The first point on our compass is a big word, beneficence. But it's a simple and, honestly, a profound idea. It just means to always act in the best interest of the patient. Simply put, do good. In the real world, this means actively working to make a patient's health and life better. A perfect example, a doctor who takes a little extra time to teach you about your condition. That knowledge is power, right? It helps you manage your own health, and that's the ultimate way of doing good. It really all boils down to one simple question for any provider. Is what I'm doing right now truly helping this person?
Now for the other side of that exact same coin, non-maleficence. So if beneficence is about doing good, this one is its essential partner. First, do no harm.
This is basically the bedrock of patient safety. It means not doing treatments that aren't needed and always using methods that are proven to be safe. Think about something as simple as using sterile tools. That's non-maleficence right there, preventing a potentially really dangerous infection.
And the question here is just as direct. Is there any way this could end up harming the patient? It's like a constant risk check that protects the patient at every single turn.
So these first two ideas, doing good and not doing harm, they build up to what is probably the most central idea in person-centered care, autonomy. This is your fundamental right to make the final call about your own body and your own healthcare. Full stop.
Now, what's really important here is that for autonomy to be real, two things have to be there: clear, easy to understand information, and the complete freedom to choose without any pressure. You have the right to accept a treatment, but just as important, you have the right to refuse it, and that decision has to be respected.
So the real guiding question isn't just, did the patient agree? It's, did the patient choose freely? That one word, freely, is the true test of whether autonomy is actually happening.
Okay, so we've covered the ethical shoulds. Now let's switch over to the legal stuff, the rules and regulations that turn these ideas into actual requirements. This is what we must do. You can think of these laws and regulations as a huge safety net, and they aren't just there to protect you, the patient. They're also there to guide and protect healthcare workers by giving them clear rules for providing care that's safe, respectful, and accountable. Right at the heart of this legal framework is something called informed consent. It's really just a three-step process. First, you have to actually understand what's being proposed. Second, the potential risks and benefits have to be laid out clearly. And third, your agreement, your consent, has to be given freely, with no strings attached. It's basically autonomy, just written into law. So we've got the ethics and we've got the laws. But what does all this actually look like in a real hospital or a clinic? Let's talk about what care in action looks like.
You know, when you boil it all down, past all the big words and the regulations, person-centered care is about one thing: human connection. It's about a healthcare provider actively listening to your story, respecting your choices and your values, and offering genuine support. It's as simple and as profound as that.
And this quote just nails it. Good care is not just about being clinically correct, it's also ethically right, legally safe, and focused on the person. It's about treating the whole you, not just whatever condition you have. So I'll leave you with this question. The next time you're in a doctor's office or a hospital, what are you going to be looking for? Will you see care that's just technically correct? Or are you going to seek care that is truly, deeply person-centered? Because that is the standard we should all be expecting. Thanks for tuning in.